What we need is not more medications, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. And I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Hello and welcome. This is Exposé with Tony Akinyemi, and I'm your regular host. We signed off last week with breast screening methods, and we mentioned the very first one, which is breast self-examination. Today we continue with other aspects of how to screen for breast diseases and how to address them if any breast disease is diagnosed. Now, the second breast screening method that we'll be talking about today is mammography, which is usually used in conventional medicine. Now, according to the online free medical dictionary, mammography is the study of the breast using X-ray. The actual test is called a mammogram, and there are two types of mammograms. There is a screening mammogram and a diagnostic mammogram. Now, a screening mammogram is ordered for women who have no problems with their breasts. It consists of 2 X-ray views of each breast, just to screen to see whether everything is fine or not. Then there is a diagnostic mammogram, which is for evaluation of new abnormalities, or if patients with a past abnormality requires follow-up. That is a woman with breast cancer treated with lumpectomy, and then they want to follow up to be sure that everything is fine. Additional X-rays from other angles or special views of certain areas are taken in this case of diagnostic mammogram. I must point out that mammography uses ionizing radiation, for screening the breasts. And we must not forget that radiation causes cancer. So it will not be wrong to state that annual mammography will actually increase the risk of a woman for developing breast cancer later in life. Okay? This is what Dr. Samuel Epstein, a leading expert on cancer prevention, had to say, and I quote. Dr. Samuel Epstein said, "The premenopausal breast is highly sensitive to radiation. Each 1 rad exposure," the rad is the unit of measurement of radiation. He says each 1 rad exposure increasing breast cancer risk by about 1%, with a cumulative 10% increased risk for each breast over a decade's screening, unquote, from Dr. Samuel Epstein. So, for me, instead of a woman exposing herself to harmful radiation, I believe it would be better to find a healthcare provider to coach her about appropriate nutrition, detoxification, and psycho-emotional healing, and then do the other tests, self-breast examination, and what have you. Then faith in God and a positive outlook on life are key assets for disease prevention for anyone who has them. Emotional health, mental health, healthy relationships, non-toxic relationships, non-abusive relationships, no tension in marital relationships are also very key in maintaining breast health for a woman. I've stated it earlier that our thoughts and feelings have a direct influence on our body ecology or biochemical terrain and the risk of developing cancer. So in addition to radiation, mammography also compresses the breast. The breast is put between 2 plates, and the plates will compress the breast, and may actually cause any tumor that may exist within the breast to burst and spread very quickly. So, according to the website of the Mayo Clinic in the USA, you can go check it out yourself, mayoclinic.org, /tests, -procedures, mammogram, /basic, /risks. Maybe they can put the the website, the link on the screen for you to see. I viewed it as far back as April 28, 2016. That's a little over 9 years ago. Okay? Now, the risks and limitations of mammography, according to the Mayo Clinic, among others, includes the following. Number one, mammograms expose you to low-dose radiation. There is no safe dose of radiation, I must say. Mammogram exposes you to low-dose radiation. Number two, according to the website of the Mayo Clinic, mammograms are not always accurate. Number three, according to the Mayo Clinic in the USA, mammograms in younger women can be difficult to interpret. And number four, according to the Mayo Clinic, having a mammogram may lead to additional testing, unnecessary, unwarranted testing, that is. And number five, according to the Mayo Clinic, screening mammography cannot detect all cancers. It is said that mammograms can miss 1 in 5 cancers in women. 20% of cancers can be missed. A woman can do a mammogram and they say, well, all is fine. You don't have a problem, whereas the woman actually has cancer, but the mammogram actually missed it. 1 in 5 cases. Now let's talk about the alternative to mammogram, which is thermography. Now, thermography is a means of measuring the heat coming from a body. Now, the science of thermography is the application of these heat readings to locate abnormal pathology or function in the body. It's like a camera. A woman undresses and then raises her 2 hands, okay? And then a camera is focused on her 2 breasts and a photograph. That camera takes a photograph, but what the camera shows is actually the heat pattern in the breasts. And where there is pathology, where there is disease developing in any part of the breast, you will see that place will show high temperature, and it will show in red. An image of, a thermogram can be shown on the screen for you to see what I mean. Now, according to the International Academy of Clinical Thermology, IACT, thermography is based on the principle that chemical and blood vessel activity in both precancerous tissue and the area surrounding a developing breast cancer is almost always higher than in the normal breast. Now, since precancerous and cancerous masses are highly metabolic tissues, they need an abundant supply of nutrients to maintain their growth. Now, in order to do this, they increase circulation to their cells by sending out chemicals to keep existing blood vessels open, to recruit dormant blood vessels, and to even create new blood vessels. It's called neoangiogenesis. And this process results in an increased surface temperature, increased surface temperature, in regional surface temperature of the breast, in that area where that disease process is ongoing. So the process of a thermogram, is both comfortable and safe, using no radiation or compression. No radiation is involved, no compression is involved. So by carefully examining changes in the temperature and blood vessels of the breasts, signs of possible cancer or precancerous cell growth may be detected up to 10 years prior to being discovered using any other procedure. And so this provides for the earliest detection of cancer possible because of breast thermography's extreme sensitivity. These temperature variations and vascular changes may be among the earliest signs of breast cancer and or a precancerous state of the breast. Now, a positive infrared scan may indicate the presence of many different breast abnormalities such as mastitis, that's inflammation of the breast, benign tumors, fibrocystic breast disease or breast cancer, breast lumps, breast cysts, or other conditions. Now, thermography, unfortunately, is yet to be accepted as a viable screening option in conventional medicine, that is allopathic medicine. So far, it's only in alternative medicine that thermography is used. You might find some naturopaths or chiropractors, and very few functional or integrative medical doctors also use thermography. But, I can predict that thermography will soon become mainstream in the foreseeable future. All right. Now, let's go on to different types of breast cancer. Since we are discussing, breast health, breast diseases, how to care for your breasts, how to screen for breast diseases. Now, the two most common types of breast cancer are named after the parts of the breast in which they start. The first one is called ductal carcinoma or lobular carcinoma. Now, cancer that starts in the cells that line the ducts of the breast. The milk duct is where milk flows through to come out from the breast. So cancers that start in the ducts beneath the nipple and areola is called ductal carcinoma. Now, if the cancer is well contained and it's not invasive, then it is called ductal carcinoma in situ, or DCIS. Now, this type of breast cancer is more successfully treated than the invasive type. About 85% to 90% of all breast cancers are ductal carcinomas. They start in the breast duct. Now, a second type of breast cancer is called lobular carcinoma. Now, this type begins in the lobes that produce milk in the breast. The first one is in the duct that conveys milk out of the breast. But the second one actually starts in the lobes that produce milk in the breast. And the lobes are, located deeper inside the breast, under the ducts. Now, again, if the cancer is still localized within the lobe and has not spread, then it is described as lobular carcinoma in situ, as opposed to the other one, which is called ductal carcinoma in situ. So lobular carcinoma in situ, or LCIS, as opposed to DCIS. Now, about 8% or so of breast cancers are lobular carcinomas. There's also a group of breast cancers that usually invade nearby tissues. These are called invasive breast cancers or infiltrating breast cancers. They usually spread out of the original tumor site to invade other parts of the breast and body. Of course, all cancers can potentially spread to other parts of the body. It's called metastasis. But invasive carcinomas spread rather very fast. And there are several, types and subtypes of invasive breast cancer. A rare form of breast cancer is named for its appearance. It's called inflammatory breast cancer. It is the least common but most aggressive form of breast cancers. It takes the form of sheets or nests instead of lumps. It can start in the soft tissues of the breast, just under the skin, or it can appear in the skin. Now, the least common is the cancer of the nipple. And that is named after Sir James Paget, who first noticed the relationship between changes in the nipple and the underlying breast cancer. It is called Paget's disease. Now, Paget's disease of the nipple and areola often looks like a skin rash or rough skin. It resembles eczema and can cause a lot of itching. Now, I must point out that at the end of the day, breast cancer is breast cancer, whether it is ductal or lobular or Paget's or whatever. There is no type of breast cancer that should be handled carelessly. On the other hand, I must also say that cancer is only a word. It is not a sentence. Let me put it in a better and clearer format. Cancer is just a word, not a sentence, and certainly not a death sentence. Always bear in mind that cancer diagnosis is not a death sentence. Many people have defeated or conquered breast cancer before, and any newly diagnosed patient can too. Never give in to fear. Fear is the greatest enemy of a cancer patient. Fear is even more dangerous than cancer itself. After all, the Bible says in 1 John chapter 4, verse 18, in the Holy Bible, it says that fear has torments. Fear has torments. So how is breast cancer diagnosed? Quite often, breast cancers are detected only after a woman begins to have symptoms such as a lump or a pain in the breast or abnormal breast discharge or inverted nipple and what have you. However, sometimes a woman may not even have any symptom, no symptom at all. Now, the fact that a woman has symptoms, of course, does not mean that what she has is breast cancer. She might be feeling pain, she might be having breast discharge or whatever. It doesn't necessarily mean that is breast cancer. Before a cancer diagnosis is made, several different tests are usually carried out. And this includes, medical history, physical breast examination, blood tests, imaging tests, such as mammograms in conventional medicine or thermograms in alternative medicine, breast ultrasound or MRI or CT scan or what have you. This may be ordered by your doctor, and then nipple discharge examination can also be done, okay? And then in the end, if it is still, highly suspicious, then maybe a biopsy, surgery to take a sample or the entire lump and take it for histological analysis. So to do a biopsy, FNAC can be done, which is fine needle aspiration cytology, or a lumpectomy. And I'll come back to that, and we'll discuss them a little bit more extensively after this short break. Don't go away. I'll be back very shortly. Don't forget that what we need is not more medication, but more education. For the best prescription is knowledge.
If you accidentally fall out of a plane, most people think you should aim to land in water. But in reality, that's the worst option. Water doesn't compress well. And falling at over 200 miles per hour, the impact feels just like hitting concrete. It's better to choose a different landing spot. For example, DIS 2026, the Divine Impact Summit 2026. From January 29th to February 1st, 4 days of life-changing impact await you, grounded in knowledge and understanding. Here, you're not crashing. You're landing safely in wisdom, revelation, and divine insight. Choose the softest landing spot for your life. Be part of DIS 2026 and experience transformation that lasts.
Meet Emily. She's passionate about living a healthy life, but finds it difficult to access information on health and wellness.
Cancer is survivable.
That is until she discovered the online healthy living training offered by Reverend Tony Akinyemi on lms.rafainstitute.org. The online healthy living training program is a comprehensive interactive course that covers topics such as nutrition, fitness, stress management, and mental health. The course is designed to provide participants with practical tips and strategies to improve their health and well-being. Emily is now equipped with the knowledge and skills she needs to lead a healthy life. Join Emily and countless others in living a healthy life by signing up for the online healthy living training program today.
Welcome back. This is still Exposé with Tony Akinyemi, and I want to thank you for always finding time to join me on Exposé every Monday, 8 p.m. West African time on YouTube and Facebook simultaneously. And I am delighted always to be your regular host. Today we conclude our conversation on breast health, and I want to begin to wish you a Merry Christmas in advance. Yeah, next week's episode will be dedicated to our Christmas message. It will be a special edition. All right. So before we went on that short break, we're talking about different screening methods for, breast cancer. We have looked at different options, that different types of cancers, ductal cancers, lobular cancers, inflammatory breast disease, and what have you, and how to diagnose cancer. Okay, when a woman shows up, they can do medical history, physical breast examination, imaging tests, nipple discharge examination, blood work, and then before we went on that short break, I was talking about biopsy, which is surgery. It's a very minor one, okay? The first one is FNAC, fine needle aspiration cytology. What they do is they take, a big needle like that and insert it into the lump in the breast and take a small sample of the breast tissue of the lump. They take a small sample out and then take it to the laboratory for the pathologist to look at it and tell whether it is malignant, whether the cells are normal or abnormal, whether they are malignant or benign. And that would then give a definitive diagnosis that, oh, this is breast cancer. Fine needle aspiration. I am not a fan of FNAC. Okay, I'll tell you why. Now, the second one is a lumpectomy, which is the total surgical removal of the entire lump. Instead of just taking a small sample out of the lump and leaving the rest of the lump behind, the surgeon goes in there and takes out the entire lump. And the entire lump can then be sent to the lab for histological analysis. Okay? For me, that is very good. Take out the lump, take it for histology. And when the result comes back, if it is benign, praise God. If it is malignant, then we take it from there. Now, if cancer is finally diagnosed, then, a mastectomy may be advised by your surgeon, by your oncologist. Okay? A mastectomy is the surgical removal of the entire breast. Okay? So that's usually, if the tumor is still localized within the breast, it has not spread anywhere else, it's not gone into the lungs, it's not gone into the liver, it's not gone into different places, then taking out the breast means that the whole, cancer has been taken out of the body. Then a mop-up operation can take place thereafter to help the woman to continue to live her life, of course, without one breast. Okay, so that is as far as that is concerned, a mastectomy. Okay, so that is what some women don't want to hear. Once they hear, you want to cut out my breast, they run. And then they waste time until the cancer gets a chance to spread around the body and then goes into the lungs, goes into the brain, goes into the armpit, goes to different places, and then there's a big problem. The prognosis then becomes very poor. Now, when surgery is done to remove the breast in the event of breast cancer, sometimes lymph nodes under the armpits may also be removed. Now, there are a number of lymph nodes. They may say, well, we have found the cancer has also been in some of the lymph nodes, and in order to be safe, all the lymph nodes are taken out. Well, I need to make a statement in that regard. If your lymph nodes are going to be taken out, I would suggest that you tell your surgeon, it's your body, it's your money. Of course, he's the professional or she's the professional that we render professional advice, but then you also have an input to make. I would suggest that all the lymph nodes, there are several lymph nodes under the armpit, tell your surgeon to remove only the lymph nodes that have cancers in them. Not every lymph node, including the ones without cancer. Because when all the lymph nodes are removed, I mentioned the lymphatic system in a previous episode where we sweat out when I was talking about, not using antiperspirant so that you can sweat out. Because what you sweat out of your body is waste product. When all the lymph nodes are removed, then you are almost invariably not going to be able to sweat out through that armpit. So the sweat, the waste product that should be coming out from there, will be draining into the arm, into the hand. Before you know it, the hand will start swelling, getting bigger. It's called lymphedema. That's edema of the hand due to... And lymphedema is another major challenge that can be dealt with or that can arise after all lymph nodes have been taken out. So I suggest identify only the lymph nodes where cancer has been found and take them out, but don't take all, so that you can still sweat from there and prevent lymphedema later in the future. Maybe in another episode, we'll be able to talk about lymphedema and how to address it, all right? But then it's better that it doesn't happen as a result of the surgical removal of all the lymph nodes under the armpit. So now let's talk about histology. After the specimen has been taken out, either through fine needle aspiration cytology or through a lumpectomy or even through a mastectomy. Now, the specimen that is taken out is usually taken for examination. When surgery is performed, the sample that is removed is sent to the lab for histological analysis to determine whether the lump or the tumor is benign, that is non-cancerous, or malignant cancerous. Now, the histology report will then determine the next line of action. Now, biopsy and histology, that is the gold standard in cancer diagnosis in conventional medicine. Like I said, personally, I always caution women against fine needle aspiration cytology, FNAC. The reason being that once a tumor has been punctured, as it were, the capsule broken, a little sample taken, the rest is left behind, it spreads much faster than when it is still contained in the sac. I would prefer that, the entire lump is removed. I prefer a lumpectomy, total removal of the entire breast lump, than to merely puncture it or take a small sample out of it. I guess the reason some doctors, prefer to do a fine needle aspiration is because it's simpler, it's easier, and it's quicker. It's a quicker procedure. But given the fact that, sometimes, particularly in the past, thank God things are getting better now, in the past in this country, histology reports usually delay in coming, by which time no treatment will have commenced and the cancer will have started, to spread before any treatment commences. Usually by the time the histology report will be out, in the past, that will be several weeks will have elapsed, and the cancer will have started spreading because it has been punctured. Now, in the early part of this century, around 2006, 2007, 2008, 2010, in this country, in certain instances, histology reports can take anywhere from 6 weeks to even 3 months to be ready. Of course, that has changed, and we thank God for that. Now, sometimes you get your histology reports in a week or two, okay? I have known cases in those days where the patient was already dead before the histology report was out, okay? Now, what are the breast cancer treatment options? Once a person is diagnosed with breast cancer, there are many treatment options. Now, conventional cancer treatments principally involved surgery, chemotherapy, radiotherapy, and maybe hormone therapy. Now, a few other treatments, might go alongside these, and so on and so forth, but these are essentially what is done in conventional medicine. But apart from conventional cancer treatment, there are also many alternative cancer therapies that work very well. Time will not permit me to go into that, and that's not really the intention. Hopefully, sometimes in the future, I'll be able to do a series on cancer as a whole, and then we can take it up there and go into deeper discussions. So, a third option, apart from the conventional option, the alternative treatment option, a third option would be what I call integrative cancer treatment, which is a situation in which conventional treatment is combined with alternative treatment for a better, outcome. Now, every woman diagnosed with breast cancer will have to prayerfully decide what is best for her. There are a number of clinics out there that can help, both conventional, alternative, and integrative. Particularly in European countries, and in North America, as well as Mexico. United States, Canada, they have many of these alternative centers. Of course, a more thorough discussion, like I said, of breast cancer, and indeed all cancers, as well as the causes, the prevention and treatment options, will be far broader than the scope of this particular episode. So this will require me to do a more in-depth discussion, or probably to even document it in the book, which I plan to do, God willing. I hope you'll be able to do this sometimes in the future by the grace of God. So as we wrap up our conversation on breast health, let's talk about breast enhancements and breast implants. Now, so that's another thing that some women are concerned about when it comes to their breast. You know, they want to, they're interested in the looks of their breast, how their breast looks. Most women will wish that their breast would not sag as they age. However, this is mere wishful thinking. No woman can retain the same breast shape and texture throughout life. It's not possible. We all age. And as a woman ages, her breast will necessarily sag, although the degree can vary from person to person. Now, many women, therefore, undergo breast enhancement procedures just to enhance the looks of their breasts. The most common procedure, for breast enhancement is the installation of silicone breast implants. Meanwhile, breast implants could be very dangerous because some of them actually contain dangerous chemicals. For example, it was recently revealed that French breast implant manufacturer, PIP, is called polyimplant prothese, used a fuel additive in its now banned implants. And the growing litany of accusations against the now defunct company has triggered a worldwide scare with several countries, including France,